Welcome to the Aesthetics Today podcast, the premier platform where we explore the ever-evolving landscape of aesthetic treatments, regenerative medicine, and cutting-edge beauty products and technology.
So Andrew, I have been seeing you now for, dare I say, 19 years. It's a long time. How do you think Bodyvie as a company has changed in that time?
It's evolved in many ways. Everything that we have done has evolved gradually. We've tried to be broad-based. When I was young, I was told if you're ever going to sit on a stool, make certain it's got 3 legs. So we've tried to have a broad base in terms of the treatments that we offer, and we've expanded them. We've gone with the latest technology, and I think we are at the front. In some areas, we're well ahead of most of the other clinics in the UK at the moment.
So all those years ago, how did Bodyvie start?
It was Barbara's concept. Barbara's my wife, and she was the fund holding manager when we were in general practice. It started with a laser or an IPL, and from there it just evolved. The whole market has changed. And we've been picked up just like the surfers are picked up. We've just been carried by this wave. We've expanded our base. We've expanded the treatments. We've expanded our patient base as well. And we have people who've been coming to us now for 20 years.
Tell me about how your skin products came about.
Having gone into medical aesthetics, it was a natural thing to get involved with skincare products because that's your first line. We used a number of different ranges and we could appreciate their failings and their benefits, and we thought that we could, and I think we have, we could do better. So we took the best, built on those to the formulations that we now have. We listened to the feedback we had from the patients as well, be it about the colour, the smell, and we've modified according to what the patients want, and they like it and they enjoy it and they come back and they buy it. So we've got something right, and where they've come along and said, well, we don't like that smell, we've gone and changed it. The ingredients, I think, are top notch.
And what about the practicality of using your range? Because I personally don't like anything that's complicated.
No, it's not complicated. It's not a big range, but it's got the most important ingredients and it's got the most important applications as well. Not just the vitamin A and the vitamin C, but also for acne. We've got exfoliators, we've got moisturizers, we've got tints. We've got a small range, but very effective.
Could you describe your typical customer?
We've seen all the age groups, but I think particularly between sort of 30, 50, 60, that's where the majority of our patients lie.
So you've had many customers over the years and you have grown with them and you've listened to them. What are the typical things that they ask of you?
They want to look better. They want to be more self-confident. They want to have more self-esteem. And we're just there to facilitate them.
And looking better isn't just about vanity, is it?
No, it's about feeling better. It's about that inner self. And yes, looking good is important, but how you feel inside is even more important.
And tell me about the menopause, because it's a value that I put on Bodyvie, is that often people come in here and they're talking about their skin or their hair or what they feel is going wrong, but you can often get to the root of the problem, can't you?
We can. We know where it all starts. It starts when you're in your 20s. It starts with exposure to the sun. It starts with not using sun protection. But really, from your early 20s, you're losing collagen and elastin at about 1% per year, and it carries on. And then you get to the menopause and you drop off a cliff. Instead of 1 year loss, 1% loss per year, you go to 6%. So there's a rapid deterioration after the menopause, which is why HRT and its benefits are so important. HRT on its own has immense benefits, preventing osteoporosis, cardiovascular problems, stabilizing your sugar. Byproducts are that you maintain your collagen much better. You may still lose it, but it's slowed down.
So would you say now that you treat holistically your patients more and more?
I think we've always treated holistically, perhaps more so now than before, but my history and my training is that I was in general practice for 33 years, which is all about continuity of care. It's changed now, but about families. You'd have 2-3 generations registered in the practice. So it was that continuity in the knowledge and everything else that went with it. And hopefully we've brought that into the clinic as well. General practice is exactly what it is. It's a bit of everything. I had a number of years working for women's services in Ealing and Southall. I then had a working career in general practice, providing women's services as well, including family planning, including fitting coils and IUDs. This is no different. That's a holistic approach. This is as well. We're looking after not just the skin, we're looking after the person. And we've never lost track of that.
And how important are hormones in the health of your skin?
Very. There are hormone-sensitive organs, bone, skin, the best examples. Estrogen helps to protect the cardiovascular system by raising the good cholesterol, and especially the transdermals will actually lower the bad cholesterols as well. So you get this effect.
So you can help a woman here with not only her hormones, get those balanced through your knowledge, but also the externally with the skin as well.
Yes, that's a byproduct. That's not really the reason to go onto HRT. The reason is because you have symptoms that need to be controlled. The reason is that the person understands the benefits. They also have to understand the risks, because there are some. But on balance, the benefits greatly outweigh the risks. So in actual fact, every woman should go onto HRT, whether they have severe, moderate, mild, or no symptoms of the menopause.
Are you still surprised at the lack of knowledge that's out there available to women?
Yes. And it's partly because a lot of the research is difficult to understand. It takes years to analyse, and it's changing all the time. You will have studies that conflict. So you've got to take a view. Which do you believe, which don't you believe? Who's got it right, who's got it wrong? So there are somewhere between 80 and 90% of women who could benefit that aren't.
And by not benefiting, their lives are not as enriched.
That's right. On every aspect. Mortality. Big study, 400,000 women, 2 groups. One group on HRT or had been on HRT, the other hadn't. Which had the highest mortality rate? The ones who hadn't been on HRT. So you're investing in your health, you're investing in your future, and you're investing in your longevity.
But also having a productive life, a good life, a life where you're not having things like osteoporosis, which is it's frightening, the amount of damage that can do to your body, and how limiting you will be as an older woman.
That's right. 5 years post-menopause, the average woman has lost 20% of her bone mass. And that's going to carry on. It's going to carry on year on year on year. And yes, you end up with a hip fracture, you end up in hospital, you end up with pneumonia, you die. You end up with a blood clot, you have pulmonary embolus, you die. Or you're just not as healthy. I mean, the HRT gives you energy, sex drive, potentially. If just the two hormones, estrogen and progesterone, don't, then you can always throw in some testosterone as well.
So women who sit here in this chair that I'm sitting in now, you are able to talk to them about their general health, their hormone health, and also introduce them to the machines downstairs.
That's right.
And the magic cupboard. Tell me about the magic cupboard.
80%, or it used to be, the kids don't go out as much anymore, but it used to be 80% of your sun damage had occurred by the time you were 18. They're all playing on their computers now, so it'll probably be 50%. But a lot of the damage occurs when you're young because you just don't bother. However, what we do know is that the skin has been damaged, and we need to, one, prevent. So we are strong advocates of all year round sun protection. We're strong advocates of strong antioxidants like vitamin C, again as a serum, applied topically. Retinol or vitamin A, which does a number of things, including stimulating collagen and controlling the pigment cells, with vitamin C also helping to repair the DNA. But its most important function is that it speeds up the turnover of cells, and you end up with smaller, finer cells getting to the surface. You end up with better skin. It's a good place to start, it's a good place to finish, but that's going to improve the quality of the skin that we're going to be working with further down the line.
And what I love about your products is that it's not complicated.
No.
That's,
it's pretty simple.
I use really about 4 things, that's it, that's all I need.
And that's probably all you need to use. Different skin problems may require different applications of different products, but you can get by with a small range, and you can end up with much better quality skin.
So do you personally have more joy in your job because you have brought everything you've learned from general practice and working with women from all these years into the aesthetics?
It's not just working with women. I've brought a lot of things from general practice, and I had a number of areas that I had developed, such as minor ops. Yeah. Today, lots of procedures are deemed to be aesthetic, cosmetic, and therefore the NHS won't do them. We're providing a private minor operations facility. We're CQC registered, and we do minor ops here. Sebaceous cysts, different types of cysts, moles. We send them off for histology if they're suspicious. We do joint injections with steroids, with PRP, with hyaluronic acid.
So, as obviously a patient of yours, I always feel that I can come here and it's not sort of 10 minutes and I'm on the clock. I can actually sit down and not only ask you, but ask a lot of the people who work here about my various worries.
This is not the NHS, it's private.
Yes.
So, yes, people are given time. And you can afford to give them time. When I went into general practice, there were 32,000 GPs in the country. There's been a population explosion, and there are 29,000 GPs now. The government promised another 5,000, but even that's not going to be enough. And where are they going to get them? There's no time in general practice. Perhaps that's why general practice doesn't treat menopause as well as it could or should. But here we've got the time. We can create the time.
I know myself that I might be in for a facial and I'm chatting to whoever's doing my treatment about other little problems that I might have, and before I know it I'm sitting talking to you.
Good.
So there seems to be a lot of, what shall we call it,
Cross-advising.
Absolutely, cross-advising. Knowing that you're with an expert.
Yes.
I'm not talking to my hairdresser about it.
And always bearing in mind that some people will respond better than others to specific treatments. So if one isn't working as well as you would have expected it to, you can move on to something else. Or you can run them in parallel. And we have had combination treatments in the past where they've had microneedling, radio frequency and laser, and that's part of a package because they seem to work together. A lot of the time we haven't worked out which particular one has been the most effective, but they've worked very well together hand in hand. We have new members of staff, and at the beginning they shadow me. They come in for the consultations, they come in for the treatment, so they'll have heard. A lot of this is repetitive. They will have heard what's being said, what's being done. They've got first-hand experience and they can pass that on. And then, of course, we sit down with them and train them, but there's nothing to replace that, hands-on.
What is, do you think, unique about Bodyvie?
Warmth, inclusiveness, a facilitative approach to each and every patient, helping them to decide. That's what we do. Some people will come in and say, I want this and this, I've had this before. That's fine. But with everybody else, it's a question of sitting down and you come to a decision as to what is best, but not an imposed decision. It's a two-way process.
I hear quite often, oh, you don't need anything. Why don't you just grow all gracefully? What's your answer to that?
You don't have to. If you look better, you feel better. So why not just enjoy it? If it's going to make you feel better.
What are your thoughts on Botox?
Well, seeing as at least 40% of our business is Botox, very positive. We've been doing it for a long time. I think we're quite experienced. We have knowledge of most of the brands of botulinum toxin. Majority are botulinum A, but we also use the botulinum B. And again, it is insurance. When do you start? You start when action lines become passive lines. You cross that line from being young and having lots of collagen and lots of elastin to being a little bit older, and the lines that used to vanish don't anymore, and they're now passive lines. And that's the time to start using it because it'll stop those lines getting any deeper.
Why would you come to Bodyvie to have Botox done?
Because we've got 20 years worth of experience. It's as simple as that. We know what we're doing, we know the anatomy, we know the products. We know how each of the different products acts and behaves, and when to use one as opposed to another.
Fillers, something else that's widely talked about that you do here.
Yes. As you age, you've probably noticed that the face changes. You lose volume in certain areas. We use the fillers to replace that volume. The way we treat has changed over the past 15, 20 years. We used to just approach a line and inject into the line. We don't. We approach it from a completely different aspect, and that is volume. If we can replace the volume, you're going to increase the skin tension, you're going to then decrease the depth of those lines. Not by injecting into the line anymore, but injecting, let's say, into the cheek itself to give it the volume that it used to have. And again, the fat pads under gravity with age will start slipping. We're trying to pull everything back up.
A lot of people, including myself, have used Profilo. Just explain exactly what that is.
It's working on just the dermis. It's reversing what time has been taking away. It's putting back the collagen, it's putting back the hyaluronic acid. These are all things that, as we said before, you're losing collagen at 1% per year. You're reversing that. You're going to be younger. Subtly.
How do you like people to feel when they come in here, especially for the first time?
At ease. That's exactly what we try to do. We try to put them at ease, talk to them, find out a little bit about them, see what their expectations are. And that's a good place to start.
What about when people come in here and they are genuinely stressed? They might be going through a very difficult time at home and they are feeling worse by the way it's reflected on their face.
And we can discuss their problems, we can discuss their expectations, we can provide treatments that will make them look better, and then they'll feel better. In fact, they've done some research on this, on people who suffered from depression. And the outcome was that botulinum toxin improved depression. And it's not a central function, it's the fact that these people who looked depressed before looked into the mirror after they'd had Botox and they didn't look as sad as they were before. So it's all about perceptions. It's all about what's looking back at you.
What about ladies who have lost confidence and possibly through divorce?
They need to get their self-esteem back, and a lot of the treatments will actually help with that. They will look in the mirror and they will see somebody that wasn't there yesterday or the day before. And psychologically it's going to be a big boost. They may have a date coming up. It's going to be a great confidence booster.
How can you help the customer who has probably found themselves divorced? They may be in their 50s and all of a sudden they're dating again. And this is something that they haven't done for years and years. What does that lady need to help her?
Some confidence.
Yeah.
And again, the injectables can give that. There may be other problems depending on the age. Postmenopausally, vaginal atrophy may be a problem.
What's vaginal atrophy?
The vagina has got the highest concentration of estrogen receptors in the body, and once you're postmenopausal, the estrogen support goes. So the vagina dries, mucosa thins, it may be painful to have intercourse. You may have other symptoms such as stress, incontinence, dryness, pain.
And so all those things you can deal with here?
Yeah, we can. And there are a number of approaches to this. One, HRT. So it's a wonderful opportunity to check on the HRT side. If they're still perimenopausal, to check on the contraception. And you can combine contraception with HRT by using a Mirena, which is a IUS, intrauterine system that releases a small quantity of progesterone and can be used for up to 5 years. There are other treatments that you can also institute, namely estrogenization of the tissue itself. So there is a 10 microgram pessary that can be inserted for 2 weeks, and then you go on to 1 or 2 per week after that, which will keep the vagina much healthier. It thickens the mucosa, it improves lubrication, it will, or it may help with some of the other symptoms as well. And there's a strong argument for using the estrogen before if you're contemplating other treatments, be it PRP or laser vaginal treatment.
So these are all other areas that are all covered at Bodyvie.
That's right. We've brought the holistic sort of general practice approach into medical aesthetics, where I think it's been lacking, because up to now patients have gone to doctors to have Botox fillers, but that continuity has been lacking from the young years right through to your 60s, 70s and 80s. And again, HRT somehow provides more energy. If you are more energetic, you're stressing your bones. You're making osteoporosis even less likely. So there are so many advantages and benefits.